Let's talk about why preventing pressure ulcers or treating pressure ulcers early on is really important. I've had patients, and there have been famous people who've had pressure ulcers who've died from infection and sepsis. I'm Alan Bienstock, and I'm a board-certified plastic and reconstructive surgeon. My specialty is home wound care. I treat people with pressure ulcers, skin lesions, skin cancers in the home. Today, I'm going to help you and your loved one and your family manage someone with pressure ulcers. It's really important to talk about this right now. Some people can be hospitalized with infected pressure ulcers. I want to help you and your loved one, empower you and your family to prevent this from happening. As you all know, Christopher Reeve was paralyzed after falling off a horse, and a lot of people don't know he actually died of sepsis from an infection of his wounds, which he obviously developed from pressure. He's probably sitting in a wheelchair too long and developed most likely what's called ischial or buttock wounds. Due to sitting for such a long time and not having the infection managed, he became septic and unfortunately passed away from sepsis. I don't have all the details of his medical record, but this is what I was told, and some of it's speculative. I want to prevent this from happening from your loved one and your patient. So the most important thing we've always gone over in terms of minimizing infection is addressing the pressure ulcer early and making sure we're preventing pressure. Secondly, is we have to minimize chair time as well as sleeping on the back. When someone has a wound on their tailbone, I have to make sure they don't sleep on their back at all. They're turned from hip tip every 2 hours. If they have one on the buttock, which is kind of the region here, we call the ischium. You want to look over here. That's purely from sitting too long. So if you're going to be sitting, you shouldn't be sitting for more than 45 minutes to an hour at a time. Some of my patients develop these buttock ulcers. They get it from sitting in a chair, whether it's a wheelchair or sitting in a classroom or in a place of worship for sometimes 2 to 6 hours. That can cause enormous burden in terms of diminishing the arterial flow, which can lead to dead tissue and potentially infections. We have to make sure that doesn't happen. If this does happen and your loved one has a wound, this dead tissue has to be debrided immediately, meaning it has to be sharply removed, and has to have appropriate wound care generally on a daily basis with either the caregiver, a family member, and or nurses. This has to be a team effort. We want to make sure this does not get infected. Sometimes patients do require antibiotics. The best thing is to avoid that happening, but some of my patients, when I do see them and it's infected, I do a sharp debridement and I either put the patient on intravenous antibiotics in the home, which most of the time is not covered by insurance, or we'll do oral antibiotics either by mouth or via feeding tube. And once again, clean wound care, really aggressive cleaning the wounds, daily wound care, pressure relief, nutrition, these are all important. When we do other sessions, I will show you on patients why it's important how to do this. This is all discussing with how I'm going to help you and your family and empower you to manage these wounds, prevent them, and if they do develop, how to attack them early so they don't become infected. And if they do become infected, you have to have an appropriate doctor manage these. It's really good to prevent your loved one from going to the hospital. Once you go to the hospital, you and your loved one loses control, meaning you don't get to have your own caregivers, you don't establish the turning protocols as you would in the house. So really we want to minimize infection, prevent hospitalization, and prevent potential sepsis. If you have any questions regarding the topic or may want to provide any feedback, please let me know. Please subscribe when you get a chance, and I look forward to our next session. Thank you so much.